What are the best mantle cell lymphoma treatments? Imagine facing a diagnosis of mantle cell lymphoma, a type of non-Hodgkin lymphoma known for its aggressive nature. While it can sound daunting, advances in treatment over recent years have offered new hope. The most effective approach depends on many factors like age, overall health, and specific genetic features of the lymphoma. For younger, healthier patients, the standard first step often involves intensive chemoimmunotherapy. This combines chemotherapy drugs with monoclonal antibodies such as rituximab that specifically target cancer cells. Common regimens include R-CHOP, which involves rituximab, cyclophosphamide, doxorubicin, vincristine, and prednisone or R-DHAP, which adds dexamethasone, high-dose cytarabine, and cisplatin. After this initial treatment, some patients may undergo autologous stem cell transplant, where their own stem cells are collected. High-dose chemotherapy is given to attack the lymphoma, and then the stem cells are returned to help rebuild the immune system. However, recent studies suggest that not everyone needs this step, especially if they achieve a deep remission early on. For older patients or those who cannot tolerate aggressive treatments, less intensive options are preferred. A promising approach involves combining targeted therapies like Bruton tyrosine kinase inhibitors, such as ibrutinib or acalabrutinib, with rituximab. These combinations have shown to improve how long the disease stays under control and are generally easier to tolerate than traditional chemotherapy. To help keep the lymphoma from returning, maintenance therapy with rituximab is often given for 2 to 3 years after initial treatment. When the disease comes back or does not respond to initial therapy, newer options are available. Targeted drugs like BTK inhibitors and BCL2 inhibitors such as venetoclax can be effective. Immunotherapy options like lenalidomide may also be used to boost the immune system's ability to fight the lymphoma. One of the most exciting developments is chimeric antigen receptor T-cell therapy, or CAR T-cell therapy. This involves modifying a patient's own T-cells to better recognize and attack lymphoma cells, especially in cases where other treatments have failed. For some patients with very high-risk disease or those who have exhausted multiple treatment options, allogeneic stem cell transplants from a donor might be considered, though this is more complex and carries higher risks. Every treatment plan is highly personalized. Doctors consider genetic factors, such as mutations in the TP53 gene, and the specific subtype of mantle cell lymphoma, like blastoid or hyperaggressive forms. Combining targeted therapies with immunotherapy is increasingly common to improve outcomes. In summary, treatment options range from intensive chemoimmunotherapy for fit patients to targeted drugs and immunotherapy for others. For relapsed or resistant cases, CAR T-cell therapy and stem cell transplants are options. It's essential to work closely with healthcare professionals to tailor the best approach for each individual, as every case is unique. Always remember that ongoing research continues to refine these treatments, offering hope for better management and quality of life.